I want to start with my firm belief that people typically have faith in any given system until they're given a reason not to. And I think that's so important for people to understand whenever we share stories like this, because I want you to start with how you were, what kind of faith you had in the medical system, in going to the doctor, in pharmaceuticals. Were you questioning things about the system before this journey started?
Mm-mm. It's what I always tell people, blindly trusting. I don't know that I ever really gave second thought about the medical system. I just blindly trusted it. And it's one of those things where you like naturally grow up and everybody says, the doctors are, they know you better. My mother was a nurse. And I think, you see, I'm in advertising and I see drugs always advertised as safe and effective. So I don't think I ever even thought twice about going to the doctor or seeking medical help, because I think there are times when, if you had stitches, and you go and they stitch you up, like how many times as a kid. But I didn't really have a whole lot of medical issues as a kid. But I did, get stitches, fell off my bike. I did something stupid. I put a rock up my nose when I was a little kid. So I had to go to the doctor, the hospital to get it taken out, whatever.
I stapled my thumb when I was a kid.
So you get it, right? Yeah, just all these ridiculous. But right. I think, I don't even know that people really think twice about any of, especially the medical system. I think the whole system is built on trust, blind trust, and assuming that we're all going to trust the system.
Yeah. And that was really how you operated up until 2003. And take us back to what happened leading up to Woody's passing.
Yeah, so it was, 2003. I'm married for about almost 10 years. My husband and I had a great marriage. We were both doing our thing. We were talking about having kids. And I had, Woody, it was the start of 2003. He had just started his dream job with a startup company. And I had just left to go to New Zealand on a 3-week advertising shoot. And Woody started having trouble sleeping. And Wood was a guy who always needed 8 hours of sleep. We used to joke if he didn't have it, he would fall asleep, had no problem falling asleep at somebody's house at dinner. And so anyways, he kind of, like most of us, blindly trusted the system too. Went to his doctor because he was having trouble sleeping, and the doctor gave him a 3-week sample pack of antidepressant Zoloft, and said that it would take off the edge and help him sleep. Woody was an athlete. He was a big basketball player. So he, doctors fixed him. They fixed his knees. They stitched him up. He almost died of penicillin when he had his appendicitis and it burst. So, but he always thought doctors didn't get paid enough. I mean, that was kind of his belief, right? So meanwhile, Wood goes to the doctor. He's not sleeping. 3 weeks, he gets a 3-week sample pack of Zoloft and said it would take the edge off and help him sleep. I happened to be in New Zealand on a huge BMW shoot for 3 weeks. So I wasn't even at home those first 3 weeks that Wood got put on the drug. And I come back, and I'll never forget, I was excited to see him, and I came home early from work, and Woody walks through our back door. I'd never seen this before. He's bawling. He throws his bag on the floor, and he falls in the fetal position in our kitchen floor, head around his, hands around his head. "Kim, you gotta help me. I don't know what's happening to me. My head's outside my body. You gotta help me. I don't think I can handle." He's bawling, and I'm literally, I had never seen this. And I remember we calmed him down. We did, yoga breathing, praying, and, and eventually he called his doctor and told him what was happening. And the doctor said, "Oh, you got to give the drug 4 to 6 weeks to kick in." And so, I don't know, never thought again of it. But every night that next week of his life, Woody came home and he'd be like, what do you think about acupuncture? I'm going to beat this feeling in my head. Then it became like, what do you think about hypnosis? Like he was trying anything to beat this feeling where he felt outside his body looking in. And so I mean, again, not thinking anything of it, not even, looking at my husband thinking there was anything wrong. It was my busy time of advertising. So I had just left to go out of town on another BMW shoot. And I left on Monday. On Tuesday night, August 6th, I hadn't heard from Woody all day. And I call my dad finally by 7, 8 o'clock at night. And I'm like, hey, Dad, do me a favor. I haven't heard from Woody all day and he's been having trouble sleeping. So maybe he hit his head. I don't know. This is what I'm thinking. All of a sudden my dad calls me. It's bad. It's bad. And I'm like, what do you mean it's bad? And he's like, he's dead. And I'm like, what? I go, what do you mean he's dead? What do you mean he's dead? And he's like, he's hanging. I'm like, what? And literally in one second, it's almost like, I always call it my before and after point. Mm-hmm. Everything just went blank of what? I don't even know who I was. I'm sitting there going, almost like it was a nightmare or something. Just sitting going, what? He's dead? Hanging? What? I couldn't even wrap my head around it because Woody did not have a history of depression. He didn't get the drug for depression. There was nothing in my, in our 10-year marriage that I would have ever in a zillion years thought this would be the way Woody would die. And so, obviously I walked back into the studio. We're still, shooting. And I asked the guy that I was working with, I'm like, hey, can you bring me, I'm trying to hold my, my stuff together. And I'm like, hey, can you bring me back to the hotel? There's been there's been an emergency. And I get in the car and I go, Woody killed himself. And he was like, what? I'm like, anybody who knew Woody, it would have been the last thing. So I get back to the hotel. And by this time, my dad has now called my sister, my brother-in-law, my mom came over. I mean, everybody's at our house. And I get a call from the coroner, the Hennepin County coroner's office, because she was there. And she said, was he taking any medication? And the only medication Woody was taking was Zoloft. And she goes, we're going to take it with us. It might have something to do with his death. But that happened that night. The same day as Woody was found, the front page of our newspaper had an article that said the UK finds link between antidepressants and suicide in teens. All of that is happening the same day Woody was found dead. And meanwhile, I knew none of this, right? There was nothing in my mind when I left out of town that, I'm thinking we had plans. We had just booked our 10-year anniversary trip. We could not have kids unless we did in vitro, so we just booked that. We were going to Hawaii with his parents in November. So we had everything planned, and I still think about never once did we question the drug when Woody was sitting there, head outside the body. He got it for insomnia. And it was given to him by his doctor, and it's advertised as safe and effective on the television. And so at that point, I knew nothing. And as I'm trying to figure out how to get back from Detroit, my brother-in-law, my sister's husband, goes home and Googles Zoloft and suicide and was shocked at and this is 2003, learned that the FDA had hearings in 1991 on the emergence of violence and suicide with Prozac. And so there's some videos that were out on YouTube, and then he started going down a rabbit hole and ordered books. And I mean, he's doing that without me even knowing, because my life had just fallen apart. I didn't even know what to do. And so that's kind of the start of my journey, as I call now the accidental advocate journey, because I would never have chosen to do the work that I've been doing for 22 years. And it all started with my husband's death, and at that point, it also, because when something like that happens, when it makes no sense, you just start questioning things.
Yeah, I love that you said you call yourself the accidental advocate, because I feel like that is how most people find themselves being an advocate for something. They didn't plan for it. They didn't set out to speak up or against a certain thing, but life dealt them a certain hand where they have no other, choice but to then be an advocate. So, yeah, I mean, the fact that Woody went to the doctor for having trouble falling asleep. You said he had no anxiety, no history of depression. Why, of all things, was he put on an SSRI for sleeplessness?
Well, you know what? Looking back, it's interesting. I didn't know anything about the drug. So there's I always tell people, you have to be your family's advocate too. Like, I didn't even question anything. Like, I just assumed, the doctor gave it to him. I didn't even know it was an antidepressant. And Woody got it off label. And, but you know what? You have to start, once you start understanding the system, the drug companies promote it. I'm sure they're like, oh, the underlying sleeplessness is not sleeping, or it might be anxiety. He just started his startup with a startup company. So I'm sure, some of that, but I'm like a 3 a.m. wake up call as anybody who's started their own business or has their own business or just life in general. It's our time when we're still and our bodies wake up because our minds are racing, right? So those 3 a.m. wake up calls are not like you're going to go a couple weeks later and go kill yourself, right? Mm-hmm. And so I look back and go, why did the doctor give him that? But I'm, looking at what the drug companies are probably out there promoting. It was the new drug on the market. And there was no discussion of, could there have been another, first line? Maybe we should, are you exercising? Mm-hmm. Are, how's your faith life? Are you doing meditation? Help me understand what is going on in your life. Not even that.
Take a magnesium.
Yeah, anything.
Right.
Yeah, nothing. It was just a 5-minute call, or not even a call, visit, where he trusted his doctor. He loved his doctor. That's the hard part is, his doctor was probably doing, and, again, I've been doing this work for so long now that I started realizing that even the doctors blindly trust the system and the way the system and how they're being educated. And, so the whole system is built on blind trust. We trust the doctors trust that the FDA had done their job, or that the FDA does clinical trials. That's not true. The drug companies do everything. And so, I look back and I still cannot believe that he was given an antidepressant, because I even wonder, because Woody was pretty smart, and if they would have said, this is an antidepressant we are giving you, he might have said, why are you giving me an antidepressant? I'm not depressed.
Right.
But he wasn't given that. It was a sample pack that he went home with no warnings. And so at that time, there were no warnings. I'm not sure that you would even know to go Google the drug you were going on.
Sure.
And so
it was an off-brand, so it wasn't it didn't.
No, you didn't. Right. And
yeah.
So you didn't go, oh, I'm getting it for insomnia. Even if the doctor said, we're going to give it to you off-label, it's not approved for this. There's so many things that were missed in this whole experience. And it's why I, continue to do what I do all these years later, because I think this is how it happens. I've met so many families. The same thing has happened with whatever course of treatment or medication or something that they've been on. So it is what I always say, we have to ask questions. Even I wish Woody would have asked questions.
Yeah, I mean, I think it's just been in recent years that we're really learning how important it is to ask questions in those fields where we've always trusted.
Yeah.
And, you know, it's unfortunate that, like you said, the doctors, and not all, but there are a lot of doctors who aren't questioning what they're given either, because they're trusting what's being delivered. Now, you said, I think it was your brother-in-law who was reading books and things and starting to educate himself while you were in the depths of grief and trying, and shock, and trying to get through this. What types of books was he reading, and what was he finding?
Yes, I will always be so grateful for my brother-in-law, Eric. So he, obviously that night he went home because it was like as shocking to him as everybody else. Like, what? Woody killed himself? Yeah. And so, so there was obviously Google back then. And I always say, thank God for Google, because we were able to connect some dots. But the books he was reading, there was one by David Healy called Let Them Eat Prozac. There was another one, by, I think it's called the Antidepressant Fact Book by Joseph Glenmullen. And then there's one by Peter Breggin. And these were like the initial pioneers that were the ones raising the flags. Like two of them are all three were psychiatrists. And they had, had healthy volunteers, but that had conducted studies where healthy volunteers that were on antidepressants went on to take their own life. Or one of them talked a lot about violence. Because if you think about it, this was not, 2003, but the FDA hearings were 91. And so at that point, only Prozac was on the market. Almost every one of those FDA advisory committee members that sit on the advisory committee said, nope, we don't see anything. And so they kind of turned the other way. So the FDA did not, at that time, put any kind of warning on the medications. And
even though there were instances coming forward of people.
Oh, yeah. I mean, if you look at those hearings, and I tell people all the time, go and look at the footage from 1991, and you will see story after story after story during the open public hearing of families coming forward talking about their loved one's experience or their own personal experience, where somebody like blew their head off, tried blowing their head off, somebody killed their kids and then themselves. Like, it's crazy when you look at that. And almost every one of those members took money from pharmaceutical companies making antidepressant products. And so the FDA said, nope, we're not going to warn. So they didn't warn. Meanwhile, we have Zoloft and Paxil that come on the market for kids also. And Woody's now 2003. So as Eric's like, printing off things and like building up a whole case, I'm sitting there and he's like thinking, what do I do with this? I'm sitting after our funeral, sitting in the basement, like praying, like literally for anybody who's had heartache and grief, it is real. And I was sitting in our basement looking at all these life-size posters of Woody after the funeral. And I'm like trying to scratch out the pain from my heart. And I kept praying, God, take my pain and use it. It does me no good. Meanwhile, Eric's he's having the same, like his own, like, what do I do with all this? So he came to me literally like probably 2 weeks after Woody died and said, I think I figured out what happened to Woody.
Wow.
Yeah, it was that quick. And I think when you earlier mentioned accidental advocate, I think almost why they call it, like, I think they call it like the 6th stage of grief, or how you throw yourself into advocacy, because it's just somewhere for the pain to go. Yeah. Because you have no, like, what am I doing? And that's why I kept saying, take my pain and use it. I just didn't know what it was going to be. Yeah. I just wanted it out of my body. And I look at it now and go, oh, wait, I was like saying, here I am, like, bring it on. And so once you started going through and Eric had all this stuff printed and we're like, what? Like, how did they not mourn? And now we have new products. And then we were connecting the dots. Like, during this time, it was right around, Phil Hartman, he was like a famous comedian on Saturday Night Live.
Yeah.
His wife had just started Zoloft and murdered him and then took her own life. And that family ended up having a lawsuit against Pfizer. And so we're learning all this stuff that up until that point, we knew nothing. We just blindly trusted.
Yeah, I completely forgot that was Phil Hartman's situation.
And they were at that time, which now, you know, looking at what the world looks like now, they were like trying to say it was her alcoholism. No, she had just started. And so in one of those books, my brother-in-law read David Healy, and he was the guy in the UK that was responsible for helping get warnings, because they were starting to warn kids over in the UK. And so Eric wrote to him, and immediately he was the one that said, oh, I can tell you, this is Zoloft. And he goes, you might want to check out with this law firm. And so he connected us with a law firm. And so like all of this is happening. And meanwhile, I'm like, in my head, I'm like, we have to do something with this. So we started going out to DC, and I almost like maybe 4 months after Woody died. And our first person we met with was our representative, the late Jim Ramstead. And he immediately was like, I'll help you figure this out. And so he started connecting dots, and we were telling him, you know, we brought these binders of stuff that we just took off the internet, like just printed off, that was connecting the dots, and then ended up talking with the law firm, and eventually had a big wrongful death, failure to warn lawsuit against Pfizer. And so all of this, and I'm thinking, wait, I just blindly tried, like, but he was alive and now he's gone, and now, like, how am I in this? And so once you start going down the rabbit hole, which is what I always tell people, go down the rabbit hole, because one onion layer, then you go, oh, wait. And then you connect another one, oh, wait. Right. And it just keeps getting stinkier and stinkier. And that is what I have found with this situation.
Yeah, if you once trusted this and you realize there's, you know, there's more layers to it, it just keeps kind of unraveling.
Yeah. It's like, as I'm sitting in a room with like all the golf, remember, like, I don't know if you were a kid and you ever broke apart a golf ball, and you just and you just pull and pull and pull and pull and pull until you could, like, what's in the middle of that golf ball? And that's kind of what I felt like we were doing, because you'd be like pulling strings to go, wait, and there's more, and there's more, and there's more. But of course, that didn't happen right away. You know, right away, it really was trying to take Woody's story and make sure that once we started learning this information, it did us no good anymore, because Woody's gone. We knew it, that I had to do something with what we were learning, because to know and to have other families to learn after the fact, no one should ever have to ask after the fact, how come we didn't know? And during this time, we were out in DC and met so many families of little kids that, again, trusted their doctor, test anxiety, moving to a new city, which are all normal human experiences, like little 12 and 13-year-old kids hanging themselves. Oh my God. And imagine those families and those parents, like, given their, and so this was going on in 2004, and there were hearings that we eventually had that were like the 91 in 2004, and we had to actually, you know, we didn't have Zoom. That didn't exist back then. So you had to get on a plane. And there were, you know, and this is where I keep, and it's really important. So I appreciate you having this conversation, because in 1991, when it was happening, I was in college. Like, that was not at all in my life, right? So then you look at what was happening in 2004 and 2006. That was in the middle of my life. But all the new people, there were parents, you know, like, they were kids and now they're parents. So they didn't know that there's a whole history that we have kind of forgotten about.
Mm-hmm. Mm-hmm. So once you were armed with the information, you said you were brought essentially on a lawsuit to Pfizer? Wow. I mean, that is taking on, that's like David and Goliath. So what happened with that?
Let me tell you, I have such respect for really good lawyers and the power of lawsuits and why you have to have lawsuits for discovery, right? So before that, I used to always think, lawsuits are frivolous. Like, do you remember that famous, it was like the McDonald's coffee and somebody, and somehow we were all told, it's funny, like, oh, lawsuits are, ridiculous. Yes. Remember?
Yes.
And so I kind of always had that as like, held that up as like, oh, they're frivolous. Well, actually, I learned that lawsuit actually changed the coffee temperature for all the fast food. I mean, they were boiling it so hot because it was cheaper than, putting new, so it would kill off germs and all this stuff. So I look back and go, oh, wait, all the things that we've been told that we just blindly believed, right? And so that was one of them.
Interesting.
But so my law firm out in LA, they were one of the top law firms that were they did, some of the litigation that was happening around the Hartman case. There were other lawsuits happening. And so when I contacted them and they were out in LA, told them about Woody saying head outside the body, they were like, oh, we've got all kinds of documents from discovery on other lawsuits against Pfizer. And so there was one document where they actually had somebody from South African FDA equivalent writing to Pfizer, chief medical officer, saying they have patients on 50 milligrams, which is what Woody was on, saying they were outside their bodies looking in.
Wow.
Yeah. And so literally when they told us, when we, originally it was like a conversation over the phone. Then we flew out to LA, met with them and started seeing all these documents of like what the drug companies knew, the FDA knew, and we didn't know. Right. And I'm like, we have to use these. So anyways, suing Pfizer is not an easy thing to do. But at this point, Pfizer, which again, there's so much history in this, the chief lawyer for the FDA, before he was appointed that position, did not have to have congressional approval. Pfizer had paid him $300,000 to go into this position because Pfizer had all these lawsuits that were happening out there. And so his name's Dan Troy, he started on behalf of the FDA intervening with all these private lawsuits against Pfizer. And this was very intentional. So this was all happening during our time. So, and it's
what does the intervening look like?
So they were basically it's a preemption brief, an amicus brief. And so they would go to the courts and the judges would say, basically the brief said, even if the drug company, Pfizer, wanted to warn, the FDA wouldn't let them. Because they're ahead of the label, right? And so judges would throw out all these lawsuits. So this is what was happening, and I think and most of the lawsuits at that time against the company were being tossed out because of this FDA brief.
Wow.
And so that was during that time.
Passing the buck, essentially.
Yeah, totally. And eventually, so my law firm, and I know I'm telling a zillion stories because there's a zillion stories in here, but one of them went to this FDA chief counsel was speaking at a drug company litigation conference for in-house and outside counsel. He was one of their speakers, and he was talking about the preemption brief. And he said, make it a Hollywood pitch. We can't intervene in all of the lawsuits, but make it a Hollywood pitch and we'll pick and choose which ones. Well, my lawyer happened to sneak in that conference and heard it all. And so we were able to work with a member of Congress, Representative Hinchy out of New York, and exposed that and exposed the whole thing of what was happening with this chief counsel at the FDA. Dan Troy eventually left and went on to become the global chief counsel for GlaxoSmithKline. And so I started watching, I'm like, oh, this is like a strategy. And so that was happening, and I think that's what Pfizer actually was hoping in the Witczak v. Pfizer lawsuit, that it would get tossed out because of this brief. And so, you know, that we actually had a huge hearing at the federal court, and it was the Chief Justice, Rosenbaum, who was the head of the Minneapolis Federal Court. He overheard that hearing because Pfizer came in to argue that brief, not the FDA. So now Pfizer is using that brief on their own to try to get it thrown out. And it was like this game that was being played. And it was like, I still look back at those, at that courtroom. It felt like a drama because it was like a wedding, like all my friends, like it was, if you were the judge looking out, you'd be like, wait a minute, how come nobody's on this side? It was Pfizer, their 3 attorneys. And on this side, behind our attorneys, every row was filled with standing room of behind. It was super like, and they argued that brief, not once, but twice. And so eventually the case was resolved and got settled, but they were hoping that this would get tossed. And what I realized during the depositions, they didn't care about Woody. They had me for 9 hours. And let me tell you, they wanted to know everything about who knew what in DC. Like that was what they wanted to know, because at this point they had me under, you know, oath and, you know, the brief, and they wanted to know about who knew, like what binders, and how did I get Senator Grassley involved? How did I get the Attorney General of Minnesota involved? And I looked at her, like it was all intel gathering for me. And it was finally, I looked at her and I go, can I ask you a question? She goes, no, we're the ones asking the questions. And I go, I don't know what this line of questioning has to do with my husband being dead. You haven't asked me one thing about him.
Right.
Like, and at that point, it was another aha of the system doesn't care about, they don't care about Woody. Mm-hmm. They don't care about the people. That's just, they're considered acceptable collateral damage. And I was just sitting there like, again, you know, my husband's gone and I'm watching this play out in real time and I'm in business, right? And I was like, how do you operate like this? It's about putting profits over people. Mm-hmm. And they didn't care about the people. And so anyways, lawsuit, you know, that, like I said, the whole lawsuit experience was crazy. That time frame, what was happening on the national front. But one of the biggest things that happened out of it is my lawyers worked really, really hard to get all these documents that were discovered during the discovery phase.
I was going to ask about that. So what?
Yeah.
That's got to be one of the biggest benefits that came from that is what you got to learn from through discovery.
100%, because the judge for a long time, the Pfizer argued those that were trade secrets, and the judge in my case was like, these aren't trade secrets. And so you, like, literally I have a binder, and this binder became my Bible. Like I would hold it on like this because they didn't care about Woody, right? But here I'm like, oh wait, you don't care about Woody's story or Matthew's story or Candace's story or all these people that, you know, the families. I'm like, oh, but how about when you, like, this is their letterhead. Black and white on their letterhead and the FDA's letterhead. And you're like, you knew, and all of these people's lives are gone. And so that was kind of the first that I really understood the power of litigation. And, you know, now connecting the dots with what's happened in the world today and why we need. But if you can't hold the companies, they'll try everything they can to not be able to be sued, right? And so we saw it during COVID, you know, that companies were getting immunity to future issues if something happened to you or a loved one. And I was like, but that is our checks and balance.
Right.
That is our checks and balance. That is where the truth lives, in black and white.
I think what often happens, the more you are studied in something, the more degrees you have, the more you can walk a very straight and narrow path, and you can become very blind to things outside of that narrow path. And so, I mean, one of the biggest things I've learned in the last at least 5 years, but I'll say 5 because we're in 2025. So now 2020 was a big year of awakening for me and for the planet. But it was really that zoom out, because when you're too narrow focused on any one given thing and you're not looking outside of whether it's your education, your experience, your lens, you're missing out on so much of the bigger picture. And so, yeah, 2020 was a big pivotal year for me. And I wanted to ask how that was for you, you know, talking about profit over people and seeing how we had this vaccine rollout, which everybody was being told they were mandated to get. What was your gut reaction when that happened?
Well, wow, 2020 seems, you know, I think that was a big year for a lot of people to be, you know, they woke up, right? But my point of waking up was in 2003. And so I've been working in this space of the harms and seeing how like the FDA works and, you know, the lawsuit and all of these things. So then when 2020 came, and then my background's marketing. So I remember watching all of these, you know, as you said, like not having blinders on. I mean, I think that's the beauty in real life, is that you're taking information from all over, yeah, right? And you don't get caught in the blind spots of a horse blinder. So when 2020 hit, and I now sit on the FDA committee, and I know that a lot of the same committee that in 91 didn't do their job, I sit on that committee. And so I know that a lot of the drugs that are coming on the market are using fast tracking mechanisms, right? But that means you can't have a product on the market that already exists. So I'm watching this vaccine come out, and meanwhile, like it was before they're trying to like Operation Fast, Warp Speed, or whatever it was going to be. It was going to be out there fast. You couldn't use any of the products out in the market, like an ivermectin, because then you can't get it fast tracked. And I was like, wait a minute. This is all about the fast tracking. This has nothing to do with what's on the market already that is working or could be working for somebody. So that was like one red flag. Then I was like,
yeah, I just want to pause you for a sec, just so people understand. So that was granted emergency use authorization, the COVID vaccine. In order to get that emergency use authorization, they had to say that nothing else that was available to us would work in preventing getting very sick.
Yes, and so
the fact that doctors were using things like ivermectin, hydroxychloroquine, Z-Paks, monoclonal antibodies, they were using these with patients and seeing dramatic results, turn like people feeling fine.
Yes.
But we couldn't talk about that because then we would have never had the EAU.
Yes, and so a lot of those fast tracking mechanisms require that there's no other product on the market and it's why you can do it with faster or maybe less people in the clinical trials, etc. So that was one red flag for me. Another one was Pfizer, one of the most evil companies that has paid one of the most fines of any other drug company in the world up to this point. You were giving them complete legal immunity, the government was, so that if there was future harms, you had no recourse as a family member. And so I thought, well, that doesn't make sense. Then they were allowing the people who had the placebo, right? In a clinical trial, you always need that control group to make sure, so you have something that you can track long-term, harms, or does it work, the efficacy, like you have to have a control group. But during this time, if you remember, they were also letting the people who had the placebo choose to get, they unblinded the studies and then let people get the product because obviously if you go into a clinical trial, you're hoping that you're getting the product, not the placebo. So there was no placebo. We lost the control group. Then this narrative of it's 100%, you know, safe and effective. And I go, no one product is safe and effective for, like, that's not how our bodies work. 1,000,000%. I mean, and I'm like, and you're making everybody? And then the one that actually really got me was bring in your vaccine card to Krispy Kreme and you could get a donut a day for for a whole year. And I go, wait, I thought this is about health. And like, if we're having comorbidities, like you're just gonna let people just go to Krispy Kreme. I go, this is sales promotion.
Right.
It was promotion. And then
if you have to entice people to do something,
that's not like free will, and you're like, or you can't go to, like, people, like, I think back to Minneapolis when they had these mandates, and it was if you lived in St. Louis Park, they did not have vaccine mandates. So you can go to the restaurant. Across the street, you had to have a card to come in. And I was like, there were so many things that were like, where does common sense fit into all of it? And I think the power of fear is and fear and dying is what they used. And, you know, knowing how you can manipulate using, fear and hope are very powerful motivators. We use them all the time in advertising. Yeah. And so I felt like I was just watching a huge ad campaign. It was a huge ad campaign.
Propaganda at a time.
Yeah, and you couldn't question. And then I saw so many similarities with the antidepressants. If you questioned the science and you wanted to have a conversation, well, the same thing that they called back in the day with questioning how many times I got attacked as being a Scientologist. And I'm like, oh, I've seen this game before. They're just going to you're going to be an anti-vaxxer because you're questioning, oh yeah, I've seen that game. And then it became, you're a Trumper, you know, and I'm like, what? Like, just watching this whole thing become politicized. Yes. And it became politicized. And I go, oh, it was the same thing that I said back in the day. Again, I go, I would go out to DC and it was the Dems that were mostly helping us. And I remember saying to the Republicans, this is not a red or blue issue. This is a purple for people. And so I saw the exact same thing, but the opposite sides. I'm like, what is going on?
Well, and you talked about not being allowed to question it. And I think it was Chase Hughes. I shared a quote that he had said. He's describing what a PSYOP is, a psychological operation. It's like, basically, if you're being told you're not allowed to question it, or if anybody is being publicly demonized, canceled, whatever the case, that you're in the middle of a PSYOP. And it was so fascinating to me because I watched people from scientific backgrounds who understand science is a process. It's never it's not like you're at the end. You're always figuring things out. Science is always evolving. So the slogan I kept hearing over and over again, which again, it's all propaganda, it's all advertising, was trust the science. Like it was a religion, which is just wild to me. And I still, I could see it in the time, and I've talked to several people who they see it now, but there's still a lot of people who don't see it. I mean, who are still masking up, who are still touting the same things that were being at the time. So it was an extremely effective campaign for a lot of people.
Oh, it worked. And, it's interesting, the beauty of, as much on the internet, and a lot of groups were censored, right? So a lot of the harm communities were censored. As much as, that is a horrible side, remember the other side is we were able to track. And, when you start seeing clips of every news media all saying the exact same thing, stitched together. Mm-hmm. I mean, these are the things that people need to actually see. Same day, different station. It was almost like they're all reading off the same song
this is
sheet.
Dangerous to our democracy, that one clip where it was
when it was
wild.
that, or then all of a sudden, globally, if you were the leader, your husband all of a sudden got a breakthrough infection, and then everybody loved ones had breakthrough infection because that was basically what they had to do because the vaccines weren't working. And so it was interesting when you start watching, and it's why I tell people always go look for other information, because it's not what it seemed. But it was such a successful campaign, and even that idea of like questioning, you couldn't question. But again, wasn't a scientist, but I do remember my 11th grade year of science. The whole point is to keep questioning hypotheses.
Yeah.
And it was like, and then you saw this conflict or like contradictory, like, oh, no, masks don't work. And then it became like, masks work. No, you have to have multiple masks, not these kind of masks. And then it became like, well, why 6 feet? I don't know. But like, it became all of these things where you couldn't. I think what they forgot is people are people, and we're not. And I think you need to have the people that are willing to ask those questions of, it doesn't make sense, so help me understand. And so those kind of people that are just asking those simple questions, kind of like what we did way back when, we're just trying to understand like what just happened. And those questions are part of how we learn and become, smarter, and that does not mean that we're against something.
Yeah, I think some of the things I was really struggling with at that time was just like the lack of common sense when it came to some of these policies. So you could go to a restaurant, you had to be masked up. You could go with people from 4 different households, it didn't matter. You'd all be sat at the same table. You'd take your mask off, they'd bring the food out, you can share food all you want. and then you'd have to put your mask on to walk out of the restaurant. I mean, and then in schools, you had kids that were masked up sitting at tables, but then they'd go to lunch and they'd eat, or none of it made sense. And I was like, if this is a airborne thing that's so catchy, like what are we doing?
Oh my gosh. I remember one of the first was being on an airplane, and nobody, I have to say that for somebody because I traveled during this whole time, I kind of liked it because there was no middle seat. It was always empty. They blocked it off, right? So you couldn't sit next to the person. I was like, ooh, that would be great.
Yeah.
But anyways, they said you had to have your mask on except when you're eating and drinking. So I'm like, oh, can I have it? Can I have another? I was like, that's what the whole plane was doing.
Yeah.
And if it was airborne, like that doesn't make any sense either.
No.
And I think in some ways, looking back, and it makes me sad. I think the kids paid a big price for it. I think humanity did. I think there's the beauty side of it. People woke up, but I still look at now, 5 years later, and we're still playing in some of these spaces. And I don't know what I just think they overplayed their cards, and people started questioning and became. The system's never going to change inside. I think it's the outside, the rising up and people paying attention, and I think that's where the real power lives.
Yeah, absolutely. And people like yourself who share their experience and go on to create a movement. So when you started, you said there was a hearing the following year where people came together and they shared their testimony. So take me through that journey of your advocacy and what that's looked like.
Yeah, the 2004 hearings were crazy to be a part of because, first of all, we met all these families, and the lawyers would come out, the families would come out, and there would be like 100 people that were actually during the open public hearing. And everybody, I always say, go watch FDA hearings. They're fascinating. Granted, I think they are. But anyways, people got 3 minutes, one by one, to come up and tell their story in 3-minute segments. Half the audience was like, these drugs killed my loved one. And then the other half would be like, these drugs saved my life. And I'm like, my whole point during that time was, why wouldn't you just warn? Like, it's not an either or. Let's have some warning. And so fast forward, there was another hearing in 2006. Now to add warnings, again, here comes common sense. The warnings for the suicide black box FDA warnings in 2004 stopped at 18. 2006, they were going to look at all ages.
Stopped at 18 years old to take the warning off?
Yeah, so the warning existed for anybody 18 and under. Then in 2006, we were trying to get it for all ages because all ages should be warned.
Yeah, and I just got to stop you right there because were there more suicides 18 and under, like significantly more, that they just felt they didn't need to warn adults, or what was that about?
You know what? I think because that's where the UK started, but if you go back to the 91 hearings, that was all adults.
Sure.
And so I think, the kids made sense, but like the 18 didn't, right? I mean, maybe, they were saying like the brain's developing and they, but that became just what they did, like we're going to look at 18 and under kids. Well, 2006 came and we were pushing for all ages because all ages, and one of the documents that came out, Pfizer knew that it happens to all ages. The 91 hearings were all ages. Well, the FDA stops the warning at age 24. And so to this day, there is no warning for all ages. It stops at age 24. And I always say, that doesn't even make sense. Again, common sense. Mm-mm. You mean, so I'm 24 today, and I should be warned. But tomorrow I'm 25 and I don't need to be warned anymore? Like there's no risk? Or you're
That's
getting
right.
it for, it was like pre-dysphonic disorder, which is like a PMDD, which is like cramps, menstrual cramps for kids, where they said you could take the drug 2 weeks on, 2 weeks off, 2 weeks on, 2 weeks off. Well, the most dangerous time is when you go on and off. But how does your body know you're getting it for that and I'm getting it for depression? Like, it made no sense to me. I'm like, why wouldn't you just warn? Like, why wouldn't you, again, this comes, it's the simple, what is informed consent? And that's what this is, like these common sense questions of like warning, which we should be warned of all potential and benefits, right? And
Yeah, so to this day, it's just through up to 24-year-olds?
Yeah.
Unreal. So how many times does somebody like Woody at 25 and up go to the doctor and say, I'm having...
It's a huge audience. I mean, that's where there's a bulk of, the prescriptions. And I just saw some new numbers that came out. 1 in 3 women 60 and over is on some sort of psychiatric drug. 1 in 3. Wow. And so I feel like this is why it is a big issue that we need to have the information. And these artificial like dates and cutoffs, and everybody can always find science that they want to make something. But this is where I think why it's so important that as people we're willing to sit in the questions and be willing to ask, and sit in your uncomfortableness, of like, this doesn't make sense, and not feel like you can't ask about it.
And that we can ask questions and appreciate somebody else might have had great success with something.
Yeah, it's not either or.
Right, and I think that has become such a divisive narrative in our culture where if somebody questions something, as of lately, it's been the root of autism. And if they make any sort of links that somebody else feels attacked or threatened by, it's like, well, we're asking questions because we want to figure it out.
Yeah.
And we have to keep asking questions. You were mentioning the popularity of these prescription drugs. I saw statistics where it's about like 15 to 20% of the total population in the U.S. is on some sort of SSRI. And from the 90s, I grew up in the 90s. I actually had a few friends that were on something, but definitely wasn't as common as it is now. There's been about a 500% increase in the amount of prescriptions that people are getting for SSRIs, but suicide has gone up. So when you have the rate of a particular drug increase that is supposed to help with suicidal ideations with depression, with anxiety, and yet suicide continues to go up. Like, how do we wrestle with that and not want to dig deeper? I mean, this is about efficacy, and I'm not seeing the correlation.
You're asking a very good question, because that right there should be every reason why we should be looking into and asking those questions. But I think we have become, as a society, so divisive, right? Of, like you said, it works for me. I had great success. I'm still on them for 30 years, 20 years later. Somebody else is like, they didn't work for me. We have to get out of that space and create a new area of curiosity that is not black or white. It's both and.
Yeah.
And I think we have to be curious enough of going, that's interesting. If prescriptions are going up and suicides and like violences are going up, is there a correlation? We're not saying causation.
Right.
We're saying, is there a correlation? And we
Right.
should want to ask and get to the point of understanding why. And that also means kind of like what I had to do. I had to set aside all my beliefs because I had to recreate new ones and ask. That all started with questions. That means like just because you had success, like that means that both can be true.
Mm-hmm. Yeah, when you start to see all of these things connected, you can't unsee it. And, I don't know, I think to some people it seems crazy or conspiratorial, and it's so blatantly obvious when you start to dig into it.
Yeah, I think you're right. Like once you've seen, you can't unsee. And so where I learned and put this spider web that together, and that's how my brain saw it, is I would go to all these conferences all over the world with my attorneys. Back, like I'm talking 2006, 2008, and I went to one in Amsterdam in 2010 called Selling Sickness. And it was a 3-day conference put on by the Dutch government and attended, and another nonprofit called Healthy Skepticism, which I love that name. And it was attended by people from all over the EU. There was a handful of people from the US. Half of them were attorneys, myself. And 3 days conference, and almost every example that they used was from the US. And I remember after the conference, and it was all about like ghostwriting, which basically I learned is the companies, like one of the documents we got out from under seal, Pfizer knew the publication plan, meaning what articles were going to run in what medical journals. They had the titles, they knew the dates, they knew all of that. But there was a couple where it said author TBD. And I remember asking my lawyers, I'm like, what's author TBD? And they're like, well, but I go, because they already know when it's running. They're like, oh, we just have to find an author and put their name on it. So Pfizer wrote it. So that's the whole idea of ghostwriting. So I would learn about the things like this in 2010 about our country using our examples. And I'm like, we need to have this in the US. And so they had no interest in coming. So I had brought this conference to the US in 2013. And so I feel like this concept of, but people really weren't that interested. The only people that were really that interested were harms of medicine and studying the ugly side of medicine. And I don't think that's profitable. Like, no one wants to talk about the ugly side of medicine. But the reality is, I think what 2020 did is it's starting to level set. So more people are starting to like wake up, and including physicians and people that have been in the system that didn't see this concept of the spider web, or really understanding how deep it goes. Like, obviously there's some obvious things, like the US is one of only 2 countries in the world that allow drug ads.
Yeah, which is so
It's crazy, right? It's crazy. But then you look at, that's a small portion, a lot of advertising and marketing goes to the doctors. And that is through the medical journals. But then who's controlling the medical journals? Like, who's the editorial boards? Are they putting articles, that have been ghostwritten? And so then you think about doctors going to events, learning about a new disease, but realizing that the doctors who are speaking are key opinion leaders that have been paid by the industry, by the pharmaceutical companies, to spew a certain, whether it's about the disease or about a future medication that's coming. So you start learning about all of these ways that the doctors are being educated and we're being also educated in a different way, right? Influence. Yeah, influence. And so it is really important. And I know it's hard for people to not think, oh, this is just a conspiracy, until you live it. And then once you've lived it, you're like, this isn't a conspiracy. And then when you actually go and educate yourself, you're like, this isn't a conspiracy. This is how the system that we have been operating under for a long time exists. And it's my patient safety organizations that I've worked with, groups that I've worked with for years, hate when I say this, but I always say, we're not patients. We're customers. Like, we are customers because the system needs customers for it to go and continue. And then I've also come, sitting on the FDA, I've come to learn the FDA is kind of a hurdle. It's the regulatory hurdle to get your product on the market. You have to, like, if you're a company and you want to sell a product, it has to go through the FDA. So and it's seen as a hurdle, something you manage, and knowing how the system, like your clinical trials, they control every aspect of the system. Like, the FDA is not doing clinical trials to get the product on the market. The company is doing the clinical trials. They put the best people in the clinical trials that show that the product works. And so the whole system is built to promote and put products on the market. And I think and that will always be my lens, if you can come from that point of view, doesn't mean that you don't need them. I've had to use, so I'm not anti any of it. It's just I want to know the information. And I also have no problem, and I tell people, ask questions.
Yeah.
Ask questions. Like, if you're nervous because they're going to put you or your kid on some kind of medication, ask questions. You asking questions, and if they get mad, you're doing your job.
Leave that doctor. If they get mad for asking questions, we're supposed to have informed consent. And I had a doctor, a pediatrician, when my son was younger, and I didn't want to do some of the vaccinations. Well, first I asked about like the Dr. Sears, just spacing them out. And even that, she was like, you're just gonna traumatize him more times by spacing it out. There's no benefit to having them space out. And every response she gave me, just my mama intuition just went off. Like, she's not listening to me. She's not hearing my concerns. She's not giving me any accurate information about what are valid concerns that are proven. Like, not even going through the insert. I could see in inserts, that there were more concerns than she was letting on. So I left.
Well, I love what you said. I tell people this all the time. Intuition. You listen to your body. So that intuition, you knew, you're like, that doesn't make sense. That doesn't make sense.
Yeah.
Wait. And that same intuition was the night that Woody was found, right? Every part of my body was like, there's no way he would have killed himself. And so I always remind people the power of your body's intuition, knowing, and mama bears, especially when you're, no one's going to care about you or your loved one more than you will. Never. They're not going to care. Like that woman, the doctor was like, oh, well, I just don't want to traumatize your baby. really? Like, what about all the all the stuff that's in there?
Yeah, it was such a weird reason. And it just didn't sit right. And then when she wasn't willing to go over any of the actual valid proven things that are in the vaccination sheets, I just thought, no, this is not for me.
Advice. And why shouldn't we? You know, like that idea of it's our bodies, and somehow and I think it goes back to your first question in the beginning, how do we bought into a system blindly, but ultimately it's our bodies. Mm-hmm. And we need, like, again, it's not being anti, it's about like information and questioning and not just accepting and realizing that, again, no one's going to care more about you or your loved one than you.
Yeah. At the basis of it all, questioning. When we had the recent school shooting in Minnesota at Annunciation Church, I knew it was going to take no time at all before we had one side blaming guns and the other side blaming transgender issues. It's like, well, here we go. I knew of 3 different families who had kids in that school that day. Kids that were in the chapel when it happened.
Wow.
Knew the kids that passed. And I personally just thought, let them have the platform, like everybody else's opinions, and making it political right away. Those voices need to quiet down, and we just need to hold space for the people who are grieving and who are there and who have kids who have experienced it, and they're angry, they're upset, they're sad, all the things, and rightly so. So I stayed quiet. But what I would have loved to have, if I were to have engaged in that conversation that everyone was so publicly doing, I would have loved to have asked what were the medications that this individual was on, and what do we know about the medications of every school shooter that we've had so far? Because from the research that I've done, that is a very common thread. And knowing what we know now about how it can make somebody both violent and suicidal, which is a perfect recipe for somebody doing like a mass shooting, if they don't value the lives of others or their own life in that moment, then how is that not more of a conversation? It's interesting to me how much that topic seems to be suppressed when it comes to such a big issue.
Yeah, I think you ask, well, first of all, for all those families and the ones that had kids, I kind of stepped back too, because they needed the space to, like, their lives just got, nobody thinks it's ever going to happen to them or they're that close, right?
Right.
So I kind of was the same as you. It's just, and trauma's real. Those kids, those families, the community has experienced real trauma. And now we're out a couple, and I think we do have to start having some really uncomfortable conversations. And I think about this. I lived where Woody and I lived, same street, West 54th Street. I drove by that school every single day to go to work. It's right by the Starbucks. And I think about in 2003, if it wasn't for the coroner who asked that simple question, was Woody on any medication? We would never have started down that path, right? Mm-hmm. And what I realized is they don't even ask that question anymore. And so I used to think like that would have been one of the first things they would do, is ask the question, like, let's do a toxicology report.
Right.
Let's just find out what they're on. And so right now they don't. I just was on a podcast with somebody that was a California toxicologist. They don't ask, they ask illegal drugs, but they don't do the pharmaceutical drugs. And Tennessee just...
In any case?
Well, in California. But in Tennessee, they just passed a law that just happened. But I think it has to be 4 or more people that were killed, but they're going to start having toxicology of pharmaceutical products as part of the reports after a mass shooting. But it should be absolutely, again, it goes to what you said earlier, it's not a causation, but is there a correlation? Because if we don't ask these questions, we're going to keep going down the same street, and the next one will happen, and like we're going to go down the guns, and now we're adding trans. I'm like, come on, you guys.
Right.
Let's just finally hold a hearing. In 2000, remember, I go back, 91 was the emergence of violence and suicide with Prozac. There were some pretty high profile murder suicides that were, had cases, big court cases that were secretly settled. There's a long history that we have not wanted to talk about. Go to Columbine. So those kids at Columbine, that happened right before Woody's, the first hearing in 2004. Those kids showed up. A couple of the kids that were at that school showed up at the hearing. Wow. And I actually went with my attorneys down to Parkland, Florida, after the Parkland, Florida shooting, because I'm like, I am tired of having these conversations. Like, we're going to keep going, oh, it's the gun, which is, of course, we can talk about that. Of course, there's things we can do there. Of course. But again, it's not an either and or. Like, it's a both and conversation. Absolutely. And until we have it, we're all sitting ducks. And I feel like as the public, we need to start demanding this too. Because remember, we did not have congressional hearings on any of this, but in 2005, we did have a big congressional hearing at the House Energy and Commerce on the suicide aspect of antidepressants. There has never been a big investigation into the violent aspect. And it's not just the antidepressants. Like, you look at Chantix, which is the smoking drug. That came on the market with no black box warnings. It eventually got black box warnings because of hallucinations, psychosis, violence. And eventually, after they settled all the lawsuits, Pfizer got the warning removed. So there are drugs that are out there that do have, again, it's not saying you take it, this is going to happen, but can it happen? And who are the people? And so I think we do need to demand an overall big congressional hearing. I want to hear the hearings, but I'm listening to when Kennedy, I think it was the congressional, I think for him to be nominated or put into HHS secretary, Senator Tina Smith was like arguing, saying that these are completely safe and he's off his rocker. And so I ended up having a meeting with her office and brought all sorts of studies, documents from lawsuits that were uncovered to say this is not settled. This is far from being settled. I think now we've had, just even those FDA hearings, it's time that we look at all the evidence. Not just on the violence. Let's just put it all on the table. We've had it out there.
You had this meeting with her after she...
Oh, yeah.
Oh, how did that go?
It was interesting. I think the politics are so great out there right now, they're not going to help on that. But her chief of staff was somebody I went to a yoga retreat with, and I've known him. And I go, Jeff, let's remember the Democrats were the ones that used to help us out on getting to the bottom. I don't understand. This is not, I'm going to say the same thing I said back then. Purple for people. This is not a red or blue issue. Stop playing politics.
I know. And it seems like no matter what, they're the puppeteers, whoever the puppeteers are figuring out they have to have one side fighting it, because that's how they come up on top. And like you said, yes, it used to be the Democrats, and it seems to me that that's flipped. And it was so, even when I know we touched on this before, but when Trump came out and shared the Harvard study about the Tylenol thing,
granted, his delivery is
Yeah.
rash, you know, he tells women,
Yep.
like, tough it out, whatever. I get it. Like,
Yeah.
people are annoyed, rightfully so. But enough to dismiss the study because it came from his mouth. Like, if
Yes.
it would have came from Biden, I would have landed much differently. The
Yes.
delivery probably would have been differently too, but nonetheless. And I saw there was a woman who was on a ventilator in the hospital, pregnant, because she took Tylenol to prove that it was safe. And that was the last I heard. I think she.
Yeah, I don't know. I saw that too, and I'm like, really? You're gonna like prove somebody wrong? Like, this is what have we come to? And you're absolutely right. Like, we need to have some conversations, but I think that's part of the strategy, and we're fighting each other or fighting a belief instead of realizing we should be actually having conversations.
Yeah.
Having conversations and realize we're not the enemies of each other.
No, and they don't want us to come together because that's what keeps people in power.
Yeah.
So when we come together and find solutions like that, it's actually more threatening to powers than anything else.
You just reminded me of something when going through my lawsuit, and I remember my attorney said, "You'll make more damage to the company by you telling your story." And the power of coming out and having conversation and the stories. That is what they don't want. That was a long time ago that he said that. And I think the same is true today. They don't want us to have conversations. They don't want us to share our stories. They don't want us to connect the dots, because then right now it keeps everybody separate. And then we can, whoever the power, again, I don't know who they are. I always say whoever they are. Yeah. Yeah, the evil in the world. But this is where we do have to come together. Like, what? And help me understand, and I say this, help me understand why having a conversation where we're just going to look at the evidence. Let's have a court case. Why can't, okay, you guys all think that it doesn't work and you guys think it does, and let's bring all of this stuff together and have somebody who's not attached to it. Let's have, let's look at all of this, the totality. Let's have a balanced conversation, and then from there make some recommendations. But right now there'll be another one. We're gonna keep walking down, we're avoiding the conversation, or we're gonna go after the guns, or all this. Literally, let's have this conversation, because I don't want to be sitting in a movie theater and have somebody I love have to ever go through what those kids at that church did.
Yeah, I've thought about, what kinds of ways can I be impactful in allowing those conversations we had and start to getting people together. Like, what does that look like? But this is a start, having people just talk about the fact that it's not a one-sided issue. Most things aren't. It's very nuanced.
Yeah, both and it's shades of gray. And I think we've been trained to black or white. And then the last 5 years, everything's been black or white in politics, and Trump, and then not, come on, let's just have. And so I think by you having conversations like this and bringing this out to the public, I also love ideas of community. I did an event where I loved being challenged. I love being challenged on something I said.
Yeah.
And he said, well, I disagree. That's not why they gave the companies legal immunity. And I'm like, oh, really? Why do you think they did? And I could care less. And if I'm wrong, I'm wrong too. But I loved that I had somebody who felt like they wanted to say something. Yeah, because we're on the same side. Yeah. We just want to have healthy lives. And we want people to give us the best opportunity to have these lives. But we need to be able to have conversation with our neighbors.
Yeah. And the freedom to choose
Yeah.
things for ourselves.
Right?
Yeah.
I love what you're doing right now. Imagine this was live and you had a whole audience full of people from the community, whether it's at the library, right? Because they give you free space. And to have this conversation, have people come, have people question, have people just talk about it.
Yeah.
Talk about it. And that is how I think we will get better as a society.
Yeah. I feel like very inspired to do something like that because I think, you know, any parent right now with kids in the school system feels very vulnerable and helpless, and I think confused or at a loss as to what can I do to make any kind of impact. Because when you think of the grand scheme of policy changes and ways that are, you know, once that happens and what's the trickle down effect before my kids are, you know, protected, it's super daunting and super overwhelming. And so I think most parents, you know, we sit in our grief or maybe fear, maybe whatever it is. And then it's like, okay, I have to table that. I've got to, you know, I've got to do a million other things. So I think being a part of organizing something sounds empowering and like, you know, like what you said, accidental advocate, when something is on your heart so much, it just feels good to do something about it.
Yeah, and I will say, I was a person before this all happened to me. I didn't think my voice mattered. I didn't feel like I had the ability. Like I remember Woody was going to go. They were putting two cell phone towers on our corner, up on, you know, two different competing companies, and he's like, "Let's go get everybody to sign signatures and bring it to City Council." And I'm like, "Have fun," you know. I'm like, "Have fun. You'll never make a difference because you're up against cell phone companies and the City Council." And I remember him saying, "I'd rather try like hell and lose than do nothing at all, Kim." And I was like, "All right, have fun." And then fast forward, I'm like, oh my God. It was like he passed the baton, and it became like, I just did one thing. I didn't get overwhelmed with like, what's the system? Let's get black box. I didn't know any of that. It was just one step at a time. And also like, I just spoke my truth and the story, right? And what happened. And then I always say it's like the butterfly effect. If another person can do and you come together, it creates a movement. But I think there's this idea that we can't make a difference. And I always tell people, oh no, trust me, if I went out there and my why became way bigger than any fear, because I just needed to make sense of something, right? If something is on your heart, absolutely we should be doing it, because otherwise, what are we going to wait until like something happens at your school and then now you're forced?
Right.
If there's something, like I always say when people are like, I want to get rid of plastic bags at our school, go do it. Mm-hmm. But always remember, change starts with you first. And it's the one staring at the mirror back at you and believing that your voice has power. And I think that's part of what they've tried to make us think that our voices don't. But they do, and you come together and you start having conversations and you realize, oh wait, together it's even bigger.
Yeah.
So I always say, do it.
Yeah, I love that. And I feel like it's going to inspire so many people, just sharing that how one person's story, one person's journey can impact so many and change so much good when you felt helpless and
Yeah.
overwhelmed.
Well, I think back to when we went and met with the late Jim Ramstead, and he said to my brother-in-law and I, he goes, you know what you remind me of? You remind me of Patty Wetterling that was here in Minnesota, who lost her son Jacob, who just came out to do something for her son. And then it created something bigger and connecting and all of that. And I thought, wow, You know, like we all have that ability. I mean, that mom got thrown into it. I got thrown into it. How many of the other people I've met, my vax injured friends, they got thrown into it.
Right.
And so I feel like we all have something that is on our heart and we can do something about it.
I had no idea that there were no biological markers for putting somebody on an SSRI. And in fact, I was talking to someone I'm very close to saying there's really no such thing as a chemical imbalance, because they've done tests before where they've taken like spinal fluid and something else to test for is there anything off that would indicate depression, anxiety, and they couldn't find like a physical change consistent enough to say, yes, this is what it is. So the whole phrase, chemical imbalance, is just kind of this cushy word that they gave. Because if I were to go to the doctor and said, you know, I think I'm feeling, you know, sad, whatever, they would just ask questions and put me on something based on my symptoms. That was a complete shock to me, because for such subjective information, you know, that our moods can change from day to day. There can be so much in the background impacting that. But to know that that's what, you know, that is what doctors use to put us on these very, you know, serious drugs was shocking to me.
Yeah, I don't think people realize that there is no such thing as a chemical imbalance, but it has been drilled into our brains. And you look at all the initial advertising, it was like, and only a doctor can tell you. And it's like chemical imbalance, and, you know, the commercials, and they show, you know, the Zoloft commercials. But
And I just want to point out, we both know people feel very real feelings that in their bodies. Like I've had panic attacks before. Like I know it's not that those things aren't real. It's just that to call it a chemical imbalance is scientifically inaccurate.
Absolutely. Good point to remind people, because chemical, like anxiety's real, depression's real, like panic's real, trauma's real, like all of those are real human emotions. And you look at the industry that has tried to sell it off of subjective. There is no blood test. There's nothing that you can go, I think I have depression. It's usually, a lot of times it's situational. And if you look at the screening forms that they use at the doctors, it's the one that's kind of the universal screening tool. It's called the PHQ-9 form. And it says, in the last 2 weeks, have you felt sad? And it's asking a series of questions, and you rate it 1 through 5. At the very bottom of that sheet, it says, created by a generous donation from Pfizer, and then a couple of key opinion leaders. And so obviously, when you think about what would their motivation be, right? Is there any space on that questionnaire, like, tell me what happened in the last 2 weeks? Did you just get in a major fight with your spouse? Did you lose your dog? Did you lose, like, there's things that are happening in life, but that's not part of that conversation. And so that is another one that I think people have to really pay attention to. Those emotions are real. I mean, they're real, but are they truly a chemical imbalance that needs, you know, medication? Sometimes they do, but it's not the, you know, here's a quick fix. Here's a pill, here's gonna mind erase. They are not mind erasers. At the end of the day, you still have to go back and deal with whatever is still going on. Like, trust me, there's a lot of ways you can numb it that aren't pills.
Right.
And I remember wanting to move. And I was like, I'm gonna move to LA where nobody knows me. And my grief counselor goes, well, remember, wherever you go, there you are. Meaning it's still there.
Yeah.
And you have to deal with it. And so it might take the symptom, but again, it doesn't mean you have a chemical imbalance.
I was having panic attacks my junior year of high school, and I remember they were happening in the fall, like when the sun was starting to go down earlier, their days were getting shorter, and it was almost matching up with the sunset. So I didn't know if it was seasonal affective disorder, what was happening, But it was, I remember just my mom holding me on the couch, and I was just controlling, like sobbing uncontrollably. I had never had any anxiety in the past. So it was about a period of a month where I felt just this anxiety, I guess, with some panic attacks in there. We had set an appointment to see a doctor, and I am sure, knowing what I know now, I would have been put on something by my doctor. I think we made the appointment. I know we had talked about it, but one day it was like the lights just came back on, and I haven't had a panic attack since. I don't know. I didn't know at the time where that came from. But when I look back in reverse, I was really heavy when I was a sophomore in high school. I'd gotten close to 200 pounds. I had started walking every day that spring. And as I came into my junior year, I'd lost a bunch of weight. And I felt like people were seeing me for the first time, which was terrifying, to be honest.
Yes.
I feel like I had this like shell, I hid behind this like funny, whatever. And so when people would say like, oh, you look great, or they'd give you compliments, all very well intended. I felt so exposed and so vulnerable, and I didn't have, the knowledge or the insight at that time. But looking back on it, it's like, well, yeah, that's what was going on.
Absolutely. Well, that is the beauty of looking back, right?
Yeah.
But I also think like that is such a deeper conversation about spiritual awakening and an awareness, and realizing that sometimes our pains are probably our greatest opportunity for transformation.
Yes.
And using that as a place, because if you think about a heartbeat, it is what life is. This is a heartbeat, right? If it's like this, it's over, right? And so when you start looking at what life is, you were just having one of those growths.
Yeah.
Awakenings.
Yeah. Yeah.
That a drug would never have taken away.
Right. It wouldn't have. So I feel like that was a bit of a God intervention. I think my grandpa is always looking out for me. I think he was kind of like, we're just going to go ahead and put that light back on so that you don't go down that path.
Yeah. That's amazing.
Yeah. Before we wrap up, I can just tell you are a spiritual person. You've had, things that have likely happened in your journey that have given you signs of, we're not alone, God's with me. What has happened? Do you have any stories to share that has happened in your journey since Woody has passed, or anything that would give you?
Oh, I have one that's absolutely, without doubt, is what changed the game. Obviously, I had that prayer, but we were getting ready to throw out Woody's ashes in the middle of Lake Michigan. And that's where we used to live, in Chicago. And he goes, don't throw me in the ground, just throw me in the middle of the lake. Literally, it was Eric, my brother-in-law, and I were standing at the side of the boat in the middle of the lake, and everybody's telling him, you can't take him down this path of the advocacy. Right there, in the middle of the lake, we're at the edge, I'm holding this box of Woody, and there in the middle of the water is this red open book floating like this. And I go, does that say what I think it does? And he goes, yeah. In gold letters, it said, the Holy Bible.
Oh my gosh.
And it literally floated by us at that moment. And I was like, thank God it was not just me. Both of us saw it. And it became like every time I would go over Lake Michigan to go fly, to go to DC, I would look down and go, books don't float, they sink.
Right.
And at that moment, I was like, oh, no. There's a world that's so much bigger than you, Kim. You have to trust. Like, Woody's here, he's fine. Like, this is way bigger than you, but you're not alone. And so that was my sign, but I also now feel like I give it away because it's not for me alone, but this world, like, I can't argue with that. Like, I can't argue with something that was as clear as day, that was in the middle of the lake. So yeah, I mean, I never really had I always had, grew up in like faith, but I never knew what it really meant. But that day I was like, whoa, we are all connected, and it's way bigger, and trust, and you're going to be all right.
Wow.
Yeah, I know.
What a story.
I was like, oh yeah, that's a big story.
Yeah. It's just so affirming. Gosh. Thank you so much. I think that's a perfect place to wrap it up. You've inspired me to want to do more with things that I'm passionate about right now. So thank you for that. I think just sharing your story is going to hopefully open a lot of people's eyes, to at least be open to think for themselves, to follow their intuition. And that's the best, gift you can.
Oh, thanks for having. I encourage you and anybody else to go do what's on their heart, because that's how the world gets better.
Awesome. Thank you so much.
Thanks.